Alrighty, you guys. Hello, AOCPMR. We are doing an interview today with Dr. Nicolet Finger. My name is Leah, and we've got Aria here as well. We'll be asking some questions. Dr. Nicolet, do you want to go ahead and give yourself a little intro?
Sure, yeah. So I am Nicolet Finger. I am a DO, PGY3, almost PGY4 at UT San Antonio, specializing in physical medicine and rehabilitation.
Awesome. And what med school did you go to, and when did you graduate?
I went to TCOM in Fort Worth, so associated with the University of North Texas, and I graduated in 2020.
Cool.
Yeah.
So we had a little icebreaker for you. So if you had to choose a medical instrument, what medical instrument would you be?
I mean, I think I would be a reflex hammer because we're PM&R. Um, and I feel like I don't even really use a stethoscope anymore, to be honest, unless I'm on the consult service. Like once they're over in rehab, I'm like, or in the outpatient world, don't really use a stethoscope.
Fair enough.
Fair enough. That's so cute. Little hammers.
Yep, exactly.
Okay, so how did you learn about the PM&R field when you were a medical student, or did you learn about it before? And can you kind of describe your journey in discovering and matching in the specialty?
Absolutely. So I actually originally went into medical school wanting to go into OBGYN. And I had done everything like research, all of this stuff for OBGYN. During my third year of medical school, I set it as my first rotation so that, because I thought that's what I was going to do. And luckily, it was my first rotation because 2 weeks in, I decided that that just was not the field for me. Nothing against the field at all, but it just was not. I wasn't going home excited or like thinking, oh my gosh, I want to do this for the rest of my life. And I'm definitely an idealist in the sense that I want to feel that way. I want to come home so excited and just like, telling my husband how wonderful work was. And so I kind of had a like mid med school crisis, I guess, where I thought I probably shouldn't have gone to medical school because I didn't want to do the thing that I went to school for. And so I told my now husband, who was my boyfriend at the time, told him, I don't know what I want to do anymore. I don't like OBGYN. And he connected me with his roommate who was doing PM&R. I was so lucky that his roommate had a wonderful mentor, Dr. Omar Salad, that I still attribute so much of my success to. And he connected me with Dr. Salad, and I just showed up one day at Dr. Salad's office and was like, let me pick your brain about the specialty. Um, Actually, like a funny story is that I was already in my third year. People had already, set their rotations for third year. I was, I guess, late to the game, or later than other people at my school. And so Dr. Salad had no more rotations available that year. And he was just kind of telling me, I'm sorry, I don't have any more room to take any other students. And his secretary like walked in the room as soon as he said that and said someone had canceled their rotation. And so I just looked at him and was like, I'm taking it. Like that is mine. That's my month. And so we still to this day laugh at how it just felt very like meant to be.
Yeah.
And so, yeah, I'm really lucky. After that, I really just fell in love with the field and never looked back.
That's awesome. Yeah, I know that's a story that a lot of people can relate to, especially like having that mid-med school crisis of what do I want to do? Yeah.
Absolutely.
As we know, PM&R is a pretty diverse field. What are some of your specific interests in PM&R and what makes you lean more towards that?
So right now I'm thinking more outpatient musculoskeletal, specifically spasticity and like headache management. I really love doing like headache procedures. So Botox migraine, occipital nerve blocks. I also love other procedures like trigger point injections, things like that, that really like make your patient feel better right then and there. I think I get so much joy from the immediate satisfaction that they get and then the buy-in that they get because now they trust you. And so then implementing lifestyle factors seems to be easier because they kind of look at you like, okay, you really did make me feel better right now, today, when I came to see you. And so maybe what you say is true. And then they seem to implement like those lifestyle factors that we promote so much easier after having that immediate satisfaction. But I think in the long run, my dream job in PM&R would probably be to be medical director and attending of an inpatient rehab unit. I just don't know if that fits my lifestyle goals right out of residency. I want to have, God willing, I'd have some young kids at that time. And so kind of thinking about structuring my work around the life that I want outside of work as well. So that's probably later in life is the medical director thing.
No, that's
awesome.
amazing though. Especially we just need doctors in health administration right now. So that's really amazing to hear.
Yeah.
I think you kind of mentioned some interactions with patients. What are some of your favorite moments as a resident that helped reaffirm your aspirations to become a physiatrist?
So like during med school?
Or even like more of so a residency, like just interactions with any patients that specifically come to mind that you just really enjoyed, or even in med school too, as well.
Yeah. I actually have a very recent story for that. So I had a patient, very young, healthy young man. He was a weightlifter who had a left MCA stroke. It was an acute, ischemic stroke. They really just called it cryptogenic at this point. They tried to rule everything out and couldn't find any other etiology for this stroke. Some suspect that he was taking like a workout supplement that could have caused it, but even that wasn't definitive. But he had very bad aphasia, very clear, expressive aphasia, meaning he could understand everything that you were saying, but couldn't verbalize, anything that he wanted to say. And that becomes really frustrating for the patients. So you can tell, that they understand, but they can't. Everything that they say is just like, mumbo jumbo. And I started singing in the room with him because I had a little extra time that day. It's not all the time that we have as residents time to like sit down and do something with a patient. Sometimes it's just like you're in and out of the room as fast as you can because you have a million other things to do. But I had some extra time that day and I told him, hey, everyone knows happy birthday. We're just going to start singing happy birthday. And I like awkwardly sat there singing it like 3 times in a row and he was not doing anything. Like he was just like listening to me. But on the 4th time, he started singing with me, like clear as day, like no aphasia present at all in the moment of his singing. And his family was in the room. And so like him and his family all just started crying, realizing that there was a way for him to verbalize, things. And if that's not something that you or, any listeners listening haven't look into music therapy. It's really cool. You start with like automatic things that people know, songs that people know, which is why I chose happy birthday. And then you start teaching them how to like replace words with what they're trying to say. Because that is in a different part of the brain. Singing is in a different part of the brain as speech. And so that was just a really fulfilling thing. I got to take care of him for 2 weeks in inpatient rehab and he progressed really, really well. And so that is definitely one of those moments that you think this is why I came into this field.
That's awesome. Thanks for sharing that story with us. It's beautiful. Like I can't imagine how inspiring it was to be in that room. So in terms of your curriculum and residency, do you mind giving us a quick rundown of your program curriculum from PGY 2 to 4?
Yeah, absolutely. So at UT San Antonio, we are a categorical program. So we also have our intern year attached, which is just, in short, it's very PM&R focused. We only do 1 month of PM&R because of requirements that we have to meet, but other rotations are like ortho, neurology, very PM&R focused. Then starting our PGY 2 year, of course, it's like intern year all over again because now you're like a repeat intern for PM&R. And we do a lot of inpatient, our PGY 2 year. So it kind of goes like, if you look at it from a broad scale, there's like intern year, which is a mix of things, PGY 2, which is mostly inpatient. PGY3, which is a pretty even split of inpatient and outpatient, and then our PGY4, which is pretty heavily outpatient. Though all years consist of like a little of everything, that's basically the general trend. Kind of referring to call days, we take more call as in the early years, and then it progresses a little bit less and more of a supervisory role as we move into PGY4 years. So for example, PGY2 year, we take 24-hour call. It sounds harsh, but you can go home during the day and you can close your eyes and rest at night. It's just that you have to answer any calls or see any patients that have acute needs. And so that's PGY2. PGY3 year, you do a little bit of that, but you also do some backup call, meaning you're the resident who's on call is going to call if they need any help or need extra pair of hands. And then PGY4 year, we are pretty much strictly backup call. So you're just helping those that are already on call, almost as like an like a practicing attending, right? And so we kind of get more and more autonomous as the years go on, which I think is really helpful to gear us up for attending life.
Awesome. So right now you're, can you give us a description of what your day is like as a PM&R resident?
Yeah, so it definitely depends on what rotation you're on, but I can speak pretty broadly to like each type of rotation. So if you're an inpatient rotation, you're going to show up usually 6, 7 in the morning and round on all of your patients. Whether your attending wants you to pre-round or round altogether is just rotation specific. And then we typically have some sort of a team meeting with all of the therapists, the nurses, and the physicians. And we talk about each of our patients, goals for the day, when patients are going to discharge. And then we meet with our attending to talk about definitive plans for each patient. So it's very morning heavy. I compare inpatient rehab to just like the flow of the day being any other inpatient service in any other specialty, right? And when you're inpatient, usually your day is very morning heavy. And then the rest of the day, after you take care of your patients that are currently there, the rest of the day is discharges and admissions for new patients and patients leaving, as well as, of course, just taking care of things as they come up for your patients that are inpatient, but very morning heavy. And then for those inpatient rotations, we have to stay until 5 p.m. to check out to night float, because of course, if a patient is staying in the hospital or staying at a facility, there has to be a physician on call. And so we would have to stay to sign out to that night float. So that's pretty much all. We have spinal cord inpatient. We have a polytrauma inpatient, which is basically brain injury plus. So it's like brain injury plus all these other fractures, brain injury plus all these other things. So you could say it's a brain injury unit per se. And then we have a general rehab, which is anything under the sun, from liver transplants, kidney transplants, cancer, pre and post rehab. So those are our 3 main inpatient rehabs. On an outpatient side, you really it's like any other clinic. You've got patients scheduled from like 8 to 5, and you've got a break from 12 to 1. And depending on what clinic, it just depends on the type of patients you see. So that's pretty much the 2 types of rotations that we have.
Well, thanks for explaining that. Okay, so I go to TCOM, so fellow TCOMer here. There's so many Texas programs, and I mean, there's a ton of now physiatry programs all over the country. What drew you to San Antonio's program specifically?
Yeah, that's a great question. So I was lucky enough to do 4 different away rotations. So I this was like before the COVID era. I don't know how it is anymore, but they let us do as many as we want before COVID. So I did rotations at or at least at as many Texas programs as I could. And the thing that really stood out to me with San Antonio was, one, it was a big program. So, to everyone will have their own preference, but I wanted a big program. I really liked that I could learn from not only attendings, but a ton of different peers who all think differently, and have different ideas. And that is something that I wanted. I wanted a very like collaborative environment. And then I also loved that our program is very resident driven. So, you know, it's a good thing if the service hurts a little bit when the resident is gone, right? Meaning the resident was doing a lot of work. And I don't mean that in a negative way, like that we are just doing busy work all day. I mean, we're the physicians. And so that's really important. There's of course different types of residency programs, some of which, let's say you're gone for the day and the attending can absolutely cover on their own and barely even notice that you're gone. Personally, I learn best when I'm in charge and it's my job to do the work, because then I feel responsible. And so I wanted that. I wanted to be responsible for the patients. I wanted my patients to be mine. Of course, I'm always under the supervision of an attending, and our attendings are amazing. They're very hands-on. They'll jump in and help you with notes. They'll jump in and help you with like anything that you need to get done for the day. But I feel like when I'm on, it's my service and they're my patients and it's my clinic. And I wanted to feel that way at work. Otherwise, I was going to feel like a med student standing in the corner, and I didn't want to feel like that, right? Some people still learn really well when the pressure is not on them. Personally, I don't. Personally, I zone out. If the pressure is not on me, my brain is somewhere else. And so, yeah, those are reasons I love my program.
That's awesome. It sounds like a great program.
No, I think a lot of us can relate too. Honestly, even in med school, I'm like, if the pressure's off me, then I'm like, what did they say? I'm so sorry. Repeat yourself again. So thank you for sharing that, because I feel like a lot of us get nervous when the spotlight is on us, which is completely normal. But I think we will surprise ourselves with how much knowledge we can actually apply, Sorry, Aria.
Absolutely. Sorry, I don't want to interrupt either, but I think it's so important to be at a program that has a good balance, right? You don't want to be pushed so much where you don't want the attending to be off, like enjoying their day and you're just doing all of the work, right? And everything's on you. That's not learning. And you also don't want to be standing in the corner. That's not learning, right? There is a perfect like middle ground that of course everyone has to fight for, and no program is perfect. But I really feel like our program, and really a lot of PM&R programs, PM&R is just a great specialty. It's full of great people. It's full of faculty that want to teach. So I think we've got it pretty good. Like there's pretty much all of our PM&R programs in the nation are just wonderful. And we have that really good balance, right? Where the pressure is on us, but I also am not afraid to bring up to my attending if I'm overworked or if I feel overwhelmed or if I feel like I don't know what I'm doing and I need help. Or if I just have too many notes to do and I'm like, I don't have time to do these, right? I have no problem bringing that up to our attendings here. And so that's a pretty big, plus, I think.
I'm sure you get an idea of like that work environment, like with audition rotations and things. And you spoke a little bit about the audition rotations you did. And right now, third years are in the process of applying to those through VSLO and hearing back. Do you have any advice in terms of audition rotations and what to look out for, how to do well on them?
Absolutely. So I will say from a resident side, I am most impressed by students who are interested, show up on time, are respectful, all of those things that should be so obvious. And I hated hearing that as a med student because I would always think, yeah, I'm going to do that stuff. What else though, right? Like, I know I'm going to do that stuff. I know I'm going to show up on time and be interested in all that. But like, tell me like a secret thing that is going to make me stand out. And the reality is that so many med students don't even do those basic things, right? They tell you, oh, sorry, I scheduled a workout class at 3, I have to go. And you're sitting there thinking as the resident, like, I want to teach you. Like, I want to show you what our program has to offer. And you just want to leave, right? Or you're late every day. Or you are saying disrespectful things. Like, I think the really amazing med students don't realize how how those simple things get missed by other med students. And so, these rock star med students are looking for like the secret ingredient of being wonderful. And really the secret ingredient is like you just being your professional, respectful self, and being interested, because those students stand out so much. Now I'll say the one thing that has made other med students, like being on this side, stand out even more so is when they pick things up, right? So like, I don't expect anyone to know pretty much anything their first day of the rotation, but it's really impressive when you tell a med student something and then they remember it the next day, or you show them how to do a procedure. My watch is listening to me. Or when you show them how to do a procedure and the next day they ask a question on the procedure because they were obviously paying attention, right? Like, hey, I saw that yesterday you did X, Y, and Z. Why did you do this instead of this, right? Or I had a med student who I did a procedure and she paid attention to the supplies that I needed, asked a couple questions like, oh, which size needle do you usually use, blah, blah, blah. And the next time I did it, she had it ready for me. So those things, picking things up along the rotation are like, that is cherry on top. Like that is super, super impressive. And that's not something you have to do from day one. It's just something that, hey, as you go through this month, start picking up and noticing these little things.
That's great advice. I'm sure that's gonna take people very far in their rotations.
No, definitely. I appreciate that. And I mean, yeah, it's true, because I feel like a lot of students are always wanting to know the secret ingredient to everything. But I mean, yeah, true. If you're a good student, then that's all that really matters, and it'll shine through. Okay, kind of more of a fun question. I feel like a lot of people know you from good old Instagram. Can you kind of talk about your journey going through like social media platform and how your Instagram grew, and maybe how that's even affected you as a physician?
Yeah, absolutely. So when I was interviewing for residency, I really didn't talk about it with anyone. I just kind of let it be. Like if people saw me on social media, then they did. I didn't do the thing where like I changed my name. I know a lot of med students will like change their name on Facebook or Instagram or something so as not to be found. I think that's fine. I think if you're, my personal recommendation would be not to do that, because people can still find you, and then it might be a red flag. Like, why is their name different? Like, are they trying to hide something? But I think that it's totally fine to set everything on private. Like, if you want everything put on private, then that's totally fine, and that doesn't raise any red flags, right? It's just like, oh, that person wants their privacy. But at least for me, I found a lot of worth in networking through social media. For medicine specifically, Twitter is like really big. I mean, people hashtag med Twitter or med student Twitter and help each other a lot with networking. I even got an interview for residency from Twitter. I was like messaged by one of the faculty members at a residency program, and they asked, hey, have you interviewed with us? And I said, actually, I haven't heard back. Like, I applied, but I haven't heard back from your program. And then the next day I got an invite for an interview. So like that, if your persona on social media is positive and is representative of what is on your application, you have nothing to worry about. People are so worried about being unprofessional or somebody judging them for what they have. If your hobbies section of your CV says that you like to run and hike and go camping, and somebody looks at your social media and they see you running and hiking and camping, that is only going to make you that much more of a real human being, right? And is quite literally an extension of your application, because now they feel like they know you. I'm sure we've all had the like phenomena where we feel like we know people we follow on social media. That happens in interviews, right? So if somebody has seen you on social media and now you're interviewing at their program or later in life for an attending job, they're going to feel like they know you more than they really do, which is in your benefit. Because what people are more likely to choose, vote for, hire people that they feel like they know. And so I am all about social media, obviously. I kind of went off track there, but I think as far as how I got involved, mine started as a way to share like healthy recipes. And then later when I got into medicine, I just wanted to share more of my life. And so then that's how I kind of got into to that side of things.
That's awesome. I love your account. Especially, we'll shout you out at the end too, but y'all, she has great medical advice out there, like, but also social life as well. You have dogs, right? Two dogs?
I've got a cat.
Oh, a cat. I'm sorry. The
No,
fellow
no,
cat
you're
person,
okay.
I should know this.
That's totally fine. I wasn't a cat person until I got my own cat. And then I was like, now I'm in love.
They're the
But I think
best.
I'm just a my cat person.
But yeah, I mean, you have great advice that you always share on there and who to follow and what to trust on the internet, what not to trust. You're definitely one of those people that I would always go to for trustworthy information. So I appreciate that.
Thank you.
Yeah, that's awesome. And I actually first ran into your like platform on TikTok. And you have a pretty solid platform going there too. And it's very relatable content. I definitely appreciate when I see it on there.
Thank you. I appreciate that.
Yeah. So I know initially you talked a little bit about COVID and how it affected audition rotations. How do you think COVID has affected the field of PM&R, if it has?
I think it so during COVID, I feel like is different than like how it affected PM&R as a whole, right? Moving forward. I think during COVID, the residents that were trying to graduate residency got a little short end of the stick because they missed some procedures, right? Because a lot of these elective, like Botox for migraine, those types of procedures that, yes, that patient can be managed instead on just medications that can be sent virtually over a telemedicine visit. Those procedures were kind of skipped. But now those have all come back. I mean, we are not seeing, at least here in San Antonio, we're not seeing any decreased number of like procedures or anything like that. I will say that a positive thing, which is kind of what I feel like is maybe the only lasting effect that I've kind of noticed, is more telemedicine. In PM&R, it's hard to do that in general, and there's really not a ton of telemedicine that we can do, but it opened the door for like follow-up visits, right? When you really just need to check on a patient to make sure that things are on track for the plan that you've set out. And while previously telemedicine just wasn't really done as much, now we're able to implement that. So, of course, if you're doing like spasticity injections on a patient, you can't see them on it as a telemedicine, but you might be able to follow up in 2 weeks after the injections to say, hey, I just want to ask, like, how are you doing? Is there any redness or did you have any like pain at the site, any bruising? And just checking up to make sure that the patient's still doing well and then still seeing them in person, at the 3 month mark or something like that. But it's really opened the door for those virtual follow-up visits.
That's awesome. Yeah, telemedicine is definitely changing the way medicine's delivered. It's great.
And then this is, I mean, semi-similar to that, but are you working on any research projects that's kind of come out of COVID maybe, or are you more interested in like, I know you mentioned kind of the academic health administration side, but are you doing any research? Do you feel like your university incorporates a lot of research and supports y'all with that? How is that all going with research?
So I most recently did a quality improvement project for spinal cord injury patients. A lot of the times, especially during COVID, we were getting a ton of travel nurses. And of course, as we all know, right, that was really hard on a lot of hospital systems because we rely on nurses being almost specialized in their field, right? Like ICU nurses know the ICU really well. ER nurses know the ER really well. And similarly for rehab, we have rehab nurses that know kind of the things that we're doing. For example, spinal cord injury patients deal with things that a lot of other patients don't, like autonomic dysreflexia. Brain injury patients deal with things like neurostorming, right? Or like paroxysmal sympathetic hyperactivity. And those things are not seen a lot of the times on just the general acute side, mostly because those brain injury and the spinal cord injury patients have not yet really reached their maybe like they're still, the spinal cord injury patients are still like in spinal shock, right? So they're not quite presenting how they would chronically once they get to rehab. So we were dealing with a lot of issues in regards to just knowledge and practice of spinal cord injury patients with travel nurses who had no experience in rehab. And so I created these pamphlets that kind of went through three main diagnoses or main problems in spinal cord injury, being like autonomic dysreflexia, bowel programs, like how to do a bowel program, and bladder programs. So like in and out caths, when to use a Foley, what volumes you should insert a in and out cath for, things like that. And basically the quality improvement project was just like, how do these pamphlets perform and how do we increase nurses' knowledge when they're not used to these types of patients? And that project ended up being very, very successful. We're actually going to end up probably printing those pamphlets out for the hospital. And then another like resident in the class below me has kind of also taken on that project to help make it bigger. And I think those are probably my favorite research projects, are the quality improvement projects where you can actually see, pretty quickly how well you can have an impact on the system that you work in. Other research tends to be harder for me because you don't see that impact, right? You publish a paper and it goes out into the abyss, and you hope that one day all of these things kind of combine together and someone does a lit review and of all of these studies, and then it makes the impact. Definitely still of high importance, but the quality improvement projects just are very satisfying.
I feel like that's a really good, if we have any like M1, M2s on here that are just like, how do I get into research? Because a lot of the times we think of research as like bench work or doing trials, things like that. But quality improvement projects are super, super important. And I feel like they're overlooked a lot of the times. So even if, you're going through like a family med rotation or whatnot, you can, see fall risks for the elderly in the community you're working with. Maybe see the opioid use, how that's affecting if you're doing like a physiatry rotation and their pain management, like pregnancy and carpal tunnel, see how that's related. So I feel like that's really cool that your project is being implemented in your hospital. Congrats.
Thank you. And I also think that's a really great point that you made, Leah. I think people look for like the perfect research opportunity, and a lot of the times it's not going to happen. You kind of have to create it yourself. And that's totally reasonable. It actually holds just as much credit as like doing a research study with a residency program, right? And so something I tell people a lot, especially if they don't have access to PM&R, but they want to do PM&R research, is like find something rehab related on the rotation that you're on. So maybe you're on a cardiology rotation and you find someone with unique cardiac pathology going through cardiac rehab. That is PM&R related, right? So you can write up that case study. And yes, it's not on a PM&R rotation, but that's still just as beneficial, if not maybe more, because you got a perspective from another angle. And that's just like one of many examples. You can find tons of rehab related research on other rotations that are not PM&R.
Definitely.
Yeah, definitely great points and advice for people looking for research, because I know that's becoming more of a standard for applicants. For residency interviews, when you were interviewing or just looking back, do you have any questions that you wish you asked programs as you were like screening through which ones were your top, or any questions you suggest that students interviewing ask their programs?
Yeah, I think that, definitely I would look at the program's website first and make sure that if you ask a question, it's either something about that's more in that you want more details on that's on their website, but I would make sure you're avoiding questions that are like verbatim answered on their website, right? You want to seem like you have already done a little of your own research and that you want more details. So you could even word it as like, hey, I read XYZ on your website. What do you guys mean by that? Or can you give me a real life example of that? that will make you look really good because you'll be seeming like, hey, I actually read as much as I could and figured out as much as I could on my own. And I had this other question about it. And then I think as far as questions go for your benefit, right? Because you're interviewing them too. One of my favorite questions was, what changes have you made in regards, like indirect response to resident feedback? And I feel like that gives a really good insight into the culture of a program, because we all hear that buzzword, right? Like, oh, the culture of the program, the culture of the program. No one really knows how to assess that without literally being in the program and working in the program. Like, I can tell you the culture of my program now because I've been here for 3 years. But if you're just here for a month, you can sense it, but it's kind of hard to really, really know the nitty gritty. But asking that question, right? What changes have you made in response to resident feedback? That really tells you how much they listen to their residents. And so like I could give you multiple examples. Like we've changed our night float system, we've changed our call system, we've changed multiple rotations, we've completely changed rotation sites, like gotten rid of rotation sites and added on new rotation sites based on resident feedback and what residents wanted. And so I think that gives you probably the most insight into culture, right? The culture of the program.
Yeah, that's a great suggestion, and definitely, yeah, gives insight on how much resident opinion is valued to attendings in the program. So,
I have another like little fun question. I mean, well, yeah, it's fun for me, but so social life kind of related. I know you mentioned you have a husband. Some of us single Pringles, which is like super fun too. Like single life is amazing, but then others are, in relationships, whether it's fiance, marriage, they have kids. Can you kind of talk about how you're navigating your relationship in residency? Maybe how that's changed, what tips you can give, especially, it's important to have a good support system. So if you don't mind talking about that, you don't have to go super in depth, but I'd appreciate it.
Yeah, absolutely. I definitely think having support is necessary. So whether you find that through friends, through family, through a significant other, identifying who is your support system is very important. I have friends who did not like know anyone where they were moving, right? And they didn't have a significant other. And so they teamed up with other residents in the same kind of situation and are roommates with them. And that's worked out really well for a lot of my friends, is when they kind of sought out other roommates that were also coming in as new, interns or residents in a location, because then they could kind of figure things out together and lean on each other. As far as like me personally, I was really lucky to meet my husband in medical school, and he was a year ahead of me, so he matched to residency before I did. We couldn't couples match, but we were fortunate enough to match only 2.5 hours away. And a couple of things, like two things in particular that I think we did that really helped us is, the first is like we over communicate. Like, and when I say over communicate, I really mean it. Like we will talk about the same thing like several times just to ensure that we're on the same page. Because a lot of the times, things change too. Like you could talk about something one day and then 2 days later, someone changes their mind or someone feels differently, or had a bad day at work and like now isn't like doing well when they were doing well 2 days ago, right? So things change all of the time. And so we just have a very, very open communication in our relationship where nothing is off limits to talk about, right? Even if we've talked about it 15 times already. And then the second thing I think that we did really helped, especially those of you who are also in relationships and maybe are going to be long distance or are long distance, is we took every opportunity to talk to each other and to see each other, even if it meant making sacrifices in other aspects of our life. Of course, that's not for everybody. That is just my personal, like what we personally did, and everybody is going to be different. But to us, quality time is very important to one another. And we felt like we wouldn't have that support or feel that support in our relationship if we didn't have that. And so luckily we were only 2.5 hours away from each other, but we're able to, like, if I only had a Saturday off, I made the drive there and back same day, right? Like I would drive there, we would hang out for that day, I would drive back. Sometimes I would go there when he would even have work because I was off and he would be working. I'd go have lunch with him at his job, and then we'd have dinner when he got off, and I would drive back, right? And it stopped feeling so heavy because we would just do it. We just make the drive, or like make the phone call every day after work, or even though we felt so busy and like that wasn't feasible all the time, we just did it anyways. And looking back, it was probably one of the best decisions that we made because we really were able to like hold on to each other's support, instead of just kind of letting life take away all of our time together.
That's so cute. And y'all met at TCOM too. That's awesome.
We did.
We did TCOMers. Yeah, I think that's just really good relationship advice. Is just communication is key.
Absolutely.
Yeah, definitely. And I know we kind of all have those stress relievers as well. Obviously he's your support system. When he's not there, what do you kind of do to help relieve stress? Anything that you do, like yoga, anything, or reading? What's your like little safe haven?
Yeah. So, one of the things that I love to do is yoga. I really didn't get to do it a lot during COVID because, studios were shut down, and I guess maybe high maintenance with yoga. Like, I'm just not as good at like sticking with it if I'm by myself. Like, I need a class. There's something about being in a room of other people and like hearing the sound. If you don't do yoga, this is going to sound super weird, but like hearing other people's like breath movements and like them breathing in and out with each movement. And like there's something so therapeutic about all being in your own journey in that room and separate but together. And so I love that. But I was never very good at doing yoga like on my own because I'd put on a video and then I'd be like, oh, I don't have the energy for this, and I'd turn it off. Right. Versus like you're in the room with people, you're motivated. So I would probably say the same thing. Like if you're a workout person and you don't have the motivation to go to the gym on your own, like try a workout class, because sometimes it's really nice to just have external motivation. Or like, there's places like Orange Theory where like you paid $10 for the class and like you're going to lose it if you don't show up. And so sometimes that's really helpful. But I would say, especially during COVID, when everything was shut down and I was just kind of relying on myself, the biggest thing was that I would just go for walks every day. I lived across like a trail, and so I would just get out, get my shoes, like get home from work, put my shoes on, go for a walk. And then I would really just do anything I felt like. So one of my favorite kind of like exercises to do would be to like, my intent is just to go on a walk, but I do wear running shoes. So if I feel like it, I'll like maybe jog for a little, and then I'll like stop and walk again. And then at some point I'll feel like it and maybe like stop and do some like burpees or push-ups, and then I'll walk again. And I just kind of stop and do like whatever I feel like doing. And sometimes I walk the whole time. Sometimes I like run most of the time. Sometimes I just end up doing a body weight workout, but I just kind of let myself do whatever I feel like. And really the only requirement is for me to be outside, like doing something. And I found a lot of freedom in that because, as silly as it sounds, we're told what to do all of the time in medicine. Like we're always told what to do. And sometimes you don't want to be told what to do in the gym or in a workout class, and you just want to be like doing whatever the heck you want. And I think that's where a lot of the times people end up not going to the gym or not going to work out, because it's like, I don't want to listen to anybody anymore. I just want to do whatever I want. I want to feel a little rebellious. And so I liked that. I liked just being like, I'm just going to go outside, and if I don't feel like doing anything, I'm just going to walk. And if I feel like doing something, I'll just do it on the walk.
I love that. It's like a workout where you just follow your heart. Amazing.
Exactly.
Do you have any advice for people who just matched PM&R going into their first year?
Absolutely. I think you just have to keep an open mind and take some, and this actually really goes to anyone who's going into a subspecialty, right? Where your first year is general. Take some comfort in the fact that your first year is not in the specialty that you're going into. Because yes, that can be intimidating, right? But if you make the mindset shift from, this isn't the field and I don't know what I'm doing, and this isn't even what I'm going into, so it's a waste of time, right? And instead you think, hey, this isn't what I'm doing. This is just a bunch of stuff to support my future, but there's really no pressure because I have backup. I have upper level residents, I have attendings, and I'm not really expected to like be able to do this as a full-fledged attending, right? I'm never going to be in the ICU when I'm an attending. I'm not going to be an ortho surgeon. I'm not going to be a neurologist, but I can just be here and learn and soak it all in. And when you make that mindset shift, you actually perform better on your rotations. You will do better work. You will learn more. And like feel more energized when you leave because you're not putting all that mental pressure on yourself to be the absolute best. I actually found like I did better. Like whenever I made that mindset shift in my head, my attendings on these off service rotations would be like, you did amazing. You did wonderful this month. And it was because I didn't feel so scared to be there. Right. And yeah, I'm all about mindset games, like mindset shifts.
I honestly think that's the best advice too for that I received, at least, especially for third years, because PM&R is so specific. You know, if you're like diehard physiatry, you're kind of like, oh, why do I have to go through all these rotations? The best advice I ever heard was, okay, like you hate OB, whatever. This is like the only time you're gonna be able to see a baby being delivered. You know what I mean? Like this is the
Yeah.
times for a lot of these. And at least ending my rotation soon, and Arya, I'm sure you're the same too, because you seem like such like a lovely person as well. Like it's just like I'm like, wait, I kind of like everything. And it's funny because I'm a yoga teacher too, and it's just like your mindset, like when you have that attitude, it really shows through your actions. And it's kind of confusing too, because you're like, well, I like so much. But
Yeah, I totally get it. I totally get it.
yeah,
Yeah.
definitely good to mention that for intern year, but then also for people rotating.
Yeah, definitely. Mindset is everything.
Mindset, girl. Mm.
It really is. It really is. It must be the yoga in us. Hopefully other people understand that, but
Ah.
exactly.
Exactly, yeah. Um, Aria, do you have anything else that you want to add?
Um, I think we covered most of it. Yeah.
I know this has been like
Some
such
great
a fun
advice.
50 minutes and it just
Yeah.
flew by. Doc, do you have anything else you want to kind of add to this to wrap things up?
I really just want to encourage everyone listening that like your path is going to be so different from the people next to you. And don't let that deter you or make you feel less than. I have always been the person that had to study twice as hard as the person next to me to make the exact same grade as them. Or, you know, I have never felt like I learn the same as other people or that I necessarily even think the same as a lot of other people do. And that is a good thing, really. We need people in medicine who all think differently, who have different opinions, who are willing to, um, stand up for what they believe in. And so, really, like, you should not think less of yourself if you've struggled in med school or struggled as a pre-med or like didn't match to your top choice. I mean, like whatever your struggle was, it's only going to bring you more character and make you stronger, as cheesy as it sounds. And you'll look back and really be proud of yourself and all of the things that you've overcome.
Literally, chef's kiss to the end. That was amazing. Thank you guys so much.
Thanks for having me.
Do you want to shout out your Twitter, Instagram, TikTok?
Yeah.
Follow you, girl.
Sure. Let's do it. I am Nicolet.life on all social media platforms except Twitter. Twitter, I'm Dr. Nicolet because they don't let you have like other characters in there. So Dr. Nicolet on Twitter and Nicolet.life on everything else.
Amazing.
Yeah.
Thank you so much.
Follow you guys.